Hi, this is Oscar here, the Simple Surgeon, talking about evidence-based medicine. And today's episode will be on guidelines and EBM, where they, in my humble opinion, should be followed strictly. Thank you for watching this episode. This is episode 4 of the EBM series, and I'm talking about the dangers of evidence-based medicine, its faults and soft points. But today I will focus on the strong points of that. There are certain situations in which I think, I'm just a simple surgeon, I think the guidelines should be followed strictly. The first situation is the emergency department. So nurses and paramedics from the ambulances working in emergency department and doctors working in emergency department, I think, are justified to follow their guidelines very strictly, including and especially those regarding to resuscitation. Why? The situation changes quickly in ER department. Anybody who worked in ER knows that this is true. There can be hours of nothing fancy happening, nothing interesting happening, but then the situation may change and you need to make a lot of decisions quickly. And making decisions quickly is not often the way that our brain works best. Therefore, it is best for the patients and the doctors and the nurses and the paramedics' sake to follow the guidelines. The guidelines are decisions made based on evidence that give the best possible outcome. It is also important to notice that especially in the resuscitation, the resus situation, the chances of success of reviving a person are low, and giving them the best chances we can only achieve by following the guidelines. I cannot think of any other way, like taking it from experience. You would need to attend, I don't know, 20 per day or 30 per day to make up your own mind and bring out the experience. And how many lives we sacrifice at that time, we don't know. Therefore, in ER, especially in resus, follow the algorithm, follow the guideline. I think this is the best way to deliver the best quality of care for the patient and the least burden to the medical staff, especially that a lot of those situations will have an unfavorable outcome, which means that the patient will die. Therefore, then you can say we did everything we could. And because the action is fast, everybody should know, or at least have an idea what's happening next. If you follow the guidelines, everybody around you in your team will understand what you're saying at the time. They will understand the line of your thought, the line of an algorithm. If you deviate from the algorithm from to one side or to the other for a certain reason, and explain that, that will be also understood. But you say this is a deviation because nothing else is working. But up until you can just follow the guidelines, and this is the best way. The second situation I see that deflecting or deviating from the guidelines may harm patients is oncology. Oncology has developed certain protocols for certain cancers, certain neoplasms, I should say, and these not guarantee but give the best chance to the patients. And here my arguments are slightly different. Well, the first argument is that in some cases the mortality is so high that we can only base our treatment or evidence because experience cannot help it. We would need to have loads of years of successes and failures to develop as much as the research can give us. And the second way and the second argument for oncology, in my opinion, is that there are certain types of neoplasms that have a very high survival and cure rate. And it would be a waste not to use the knowledge that is behind it for the sake of those patients, for the sake of using your experience and so on. So whether there's a high mortality or high survival, I think the guidelines here are very helpful. Now the situation can vary. Patients may not respond as you expect them. And there are certain situations you need to go for experimental treatment or other types of treatment that are not in the protocol. But first, give them the best chance. This is what I think. I'm just a simple surgeon. Thanks for today. And in the next episode, next video, I will give my opinion on the situations that I think that EBM and guidelines should be used with reserve. Bye.